Good evening, friends. Happy Diwali to all of you. Once again, this is Dr. Chetna's clinic, and we are back with a very interesting new topic, which is multiple pregnancies. So, you all know what is multiple pregnancy. Multiple pregnancy is commonly known as twin pregnancy, but some people will have it triplets, that means three or four or more. So, we call it multiple pregnancy. Now, multiple pregnancy is a very common problem these days. Earlier, women used to have only 1% women used to have twin pregnancies, and higher order pregnancies were extremely rare. But with the use of assisted reproductive technologies, that means the fertility treatment, because women do not want a baby till a later age, and then they use our facility of assisted reproduction to have babies. So they take medicine for more egg formations. And when this happens, so many times there are multiple pregnancies. That means more than one fetus in the tummy. And these pregnancies, they behave very differently compared to a singleton pregnancy. So today we're going to talk about multiple pregnancy, essentially twin pregnancy, and sometimes it is triplets. So more than 1% of women, they have multiple pregnancy or a twin pregnancy. Now, these twins can be of two types, as you understand. The twins which look the same, like twin or unlike twin. Like twins are those who come from the same eggs, and these divide once the zygote is formed, and after that, it's broken into two, and then two different babies are born who look exactly the same and they are of the same gender. Either these are two boys or two girls, and they are of same height and health, and so much so that even if they are separated at birth and if they meet after 10 years or 20 years, they behave the same, they weigh the same, their choices are the same. And there have been many twins which were united after 3 or 4 decades, and they were found to be very similar in different continents. So such is the genetic makeup of our bodies, that react or that behaves in that particular manner, that twins, in spite of being separated at a very tender age, a very young age, still look and behave and weigh the same with the similar choices. So now, because uterus has limited capacity whenever there are twin pregnancies, so there is crumpling of, so there's a lot of cramming, means the same space has is used to occupy two babies instead of one. So a normal full-term baby weighs about 3 kilos, but when it comes to twins, typically both the babies weigh between 2.5 to 2.7 kilos. Sometimes one baby weighs more than the other. These are the twins wherein one twin start sucking more blood or nutrition compared to the other one. And this is more commonly seen in like twins or the single like twin, or which we call in our language a monochorionic twin, which come from a single placenta, single egg. Uh, why twin pregnancy is different than a a single pregnancy. So in twin pregnancy, the woman tends to gain more weight. She needs more attention. There are greater chance of having growth restriction, preterm delivery. There are greater chances of having abnormal babies. There are greater chances of having babies needing nursery care. So such women need more attention, more care. They have also more chance of developing diabetes, hypertension in pregnancy. So, as soon as a woman tests positive, we prescribe folic acid. The first scan is done at 7 weeks, and that's how you diagnose whether the pregnancy is single or multiple. So, when it is multiple pregnancy, you see more than one baby. In single, you see just one. Now, so many times you see at first sac two babies, and when you do the next scan at 12 weeks, that is a level 1 scan, and an early anomaly scan, you find only one baby. The other baby's heartbeat has stopped in between. This is known as vanishing twin. Now, this kind of pregnancy loss, even if it has come from one monochorionic bag or a one embryo, one zygote or like twin, has no, it doesn't impact the growth of the other baby. That means if any pregnancy, if out of twin one is lost before 12 weeks, it doesn't impact the physical or mental growth of the other baby in utero, and the pregnancy can continue. At birth, these vanishing twins will be found as a small piece of flesh which is flattened. And when the placenta delivers, along with that, this piece also comes out and recognized as a vanishing twin. Sometimes, when the vanish occurs very early, as early as 6 weeks or 7 weeks, it's very difficult to identify that small, tiny flash because the placenta is big enough and it may go unrecognized completely and not found in at the time of delivery. But it never stays inside the uterus, so there's no problem. It comes out at delivery and it has no interference with normal delivery. So such women, just like a singleton fetus, can have normal delivery. Now, when it comes to twin pregnancy, so from 12 weeks, you start. In fact, from the very beginning, you start getting two reports. In ultrasound, you get two babies: fetus A, fetus B, fetus on the left side, fetus on the right side, first fetus which is down, and upper fetus which is up, and so on. Now, every time we look at the fetus, we see the growth, the presentation, the water quantity, and the amount of blood supply which is going to the fetus. So till 20 weeks, they grow well. Now, sometimes because of the overload of the uterus, because of the multiple pregnancies, the cervix tends to get shorter. Some doctors prefer to apply stitch to the cervix to prevent preterm pregnancy, while other doctors will monitor the cervical length, the curvature, the internal os, the mucus in the cervix, the presenting part, how far it is from the cervix, to take a call whether they need to put a stitch or no. So the monitoring of twin pregnancy is much, much closer. That means women are called more often compared to a singleton pregnancy where women can stay at home and come only monthly. So typically at 12 weeks, so normally after 12 weeks, a level 2 scan is done at 20 weeks. But twins, we do a scan at 16 weeks to ensure that things are going well. Then again at 20 weeks, like others. And likewise, so typically in a singleton fetus, you may take that from 12 weeks, we do scans every 2 months to total 3 more scans. While in twin pregnancy, we do monthly scans, so in all 5 more scans. So that's how it goes. This is to identify because the twin is as such one, it makes one large volume in the abdomen, and from outside we cannot differentiate whether one is growing more than the other, whether one is having less water than the other, or one is having less blood supply or more blood supply. So to see this, we actually need to monitor, and at the same time, we also need to see that the uterus is quiescent, it's relaxed, it's not contracting, the babies are not coming down. So twins are less likely to do more physical activity. Twin women, they can exert less. They have to do closer monitoring of hypertension, diabetes. They tend to gain more weight. They tend to feel more tired, more breathless. They also need to maintain their hemoglobin better. Now, because of this over-distended uterus, when the babies come out, the uterus remains still very big and likely to bleed more. So, in a normal delivery, normally in a singleton pregnancy, the blood loss in all, including the placenta, is about 500 ml. But in twins, up to 1000 ml, it may also be considered normal. However, these days the blood loss is well controlled because of the oxytocin drugs that we have to control the medicine, to control the bleeding. We have all these medicines so that the woman doesn't bleed more. But it is very important that we control the bleeding, and also it is very important that we maintain the hemoglobin of at all time at least 11. If it is 12, we are more happy. Now, another problem that twin women face is the fetal movements. So it's very hard to monitor fetal movements. In a singleton pregnancy, we request that you monitor fetal movements from 26 weeks. That stays true for the twin pregnancy also. But the problem is, women may not be able to differentiate between which twin is moving because sometimes there could be confusion between left twin and right twin. So we have to be very careful. We must talk to them that they must feel movements on both the sides, and counting the movements in twins could be a challenge, and there could be various false alarms where women might feel that one is not moving or it is moving but it is not felt. And in such a scenario, we can do monitoring. So there are two kinds of monitoring which can be done beyond 26 weeks to know that the baby is doing well. So anytime a pregnant woman is doubtful about the fetal movements, that one is moving or both are not moving, or she wants to verify that the movements are good, she can come down to the hospital or the clinic and we can run a NST, non-stress test, or a CTG, cardiotocogram. It's the same. It's kind of ECG for the babies. So we tie the two bells on the tummy, take out a record, and that tells us whether the babies are doing well or no. There's a possibility of one baby showing a very good graph while others not showing a good graph. The common fallacy here is some people by mistake record the same twin twice. So one has to be very clear that on the graph there should not be any overlap and the two recordings are seen separately. So not to confuse the same fetus with the second one. That means one twin should not be recorded twice. We have to record two different twins separately, and we have to ensure and see that there are two different graphs on the same paper. Then still, suppose we do this and we are in doubt that one twin is doing good or both are not doing good. In this slide, we can do an ultrasound to know where, and in ultrasound you can see clearly both the fetuses differently and then figure out whether these twins are doing good or no. Now, these twins at birth should not have a weight difference of more than 400 grams. If it is so, then they are known as discordant twin. So discordancy can be seen as early as 20 to 24 weeks, wherein one fetus starts growing more and the other is less. And the one which is thinner is known as a donor twin, while the fatter one is known as recipient twin. The donor twin typically shrinks and sits along the wall of the uterus with very little water around, while the fatter twin or the recipient twin will engage all the space, free floating with a lot of water around it. So it's very kind of we sometimes we need to ensure that the other twin also gets adequate nutrition. Otherwise, what happens is if one twin shrinks and is not growing well, then eventually you have to deliver both. It's not possible to deliver one and keep the other one growing. So one should not get punished because of the problem of others. Sometimes the anastomosis of the cord is so much that one is drawing all the nutrition and other is not drawing. In such a scenario, the fetal medicine specialist can actually cut off they can separate the circulation if possible. If not, sometimes a very difficult decision of not keeping one twin needs to be taken and that cord needs to be blocked. But the problem arises when one twin dies inside on its own without having any problems, and the other twin. So what happens is whenever the circulation is common, that means if it is a monochorionic twin, so the toxins from the dead twin can actually travel to the living twin and can damage that baby. So the chances are pretty high. However, if the circulation is separate, then the toxins from this dead baby doesn't cross the placenta and the pregnancy can be allowed to continue till a reasonable maturity. And when we feel that this is a time when the other baby can actually survive and live well outside without any major support, that would be the time that we deliver the babies. And in this scenario, the woman will get only one baby, the other is already dead. But still, the outcomes could be good if it is a dichorionic twin. In monochorionic twin, there would be challenges and some monitoring will be required to know whether the surviving twin is safe or there are some issues. So some MRIs and other things can be done to know whether fetal brain is grossly affected. So that is a very challenging situation in case of twins. Now, sometimes both the twins are in the single bag. They are not separated by the amniotic membranes. Now, this is a very, very tricky situation because their cords, they get entangled because both the twins are in the same bag and there could be knots and there could be severe entanglement, so much so that it can compromise and stop the blood supply. These are known as monoamniotic twins. Now, monoamniotic twins are the most riskiest twins, and literature in different places, they suggest that delivery should be undertaken between 32 and 34 weeks. So either we deliver at 32 weeks or keep the patient hospitalized so as not to lose these babies and wait till a reasonable maturity till the time we can pull. And then once we find that there could be risk, we deliver the baby. All both these babies are typically delivered by cesarean because there is a very high risk of fetal loss in a normal delivery. Now, who all twins can have normal delivery are those twins wherein both the twins are head down and the second twin is not bigger than first twin. If the second twin is more than 400 grams compared to first twin, it's not a good idea. Now, a breech delivery of a second twin is possible, but the complication rates would be high. And all those women who have conceived with assisted reproductive technologies like IVFs would not like to have a chance. And these women typically opt for cesarean. However, if somebody is wishing to have normal delivery, they can avail normal delivery. They can opt for it and try for it. The first twin typically doesn't give any problem. There could be a need of internal portalic version. That means converting a transfer slide to a breech and then pull the baby out or something. So, uh, so it is very extremely important that twin deliveries are done in higher centers with expertise, with neonatologists present around. Now, anytime if there is a risk of suspected preterm labor, these twins need to be prepared with antenatal steroids. Two doses are given at 24 hours interval. And there are other regimes also 4 doses. This is to mature the lungs, so just in case if the twins deliver before time, they're able to breathe better and their nursery stay is shorter. So, in all, the twins are likely to have greater chances of growth restriction, greater chances of having discordant growth, a preterm labor, a leaking problem, abnormalities, mother having more chances of hypertension, diabetes, placental separation. But all said and done, the outcome in twin pregnancy is good, and majority of women with adequate antenatal care are able to reach 36, 37 weeks. Mind it, in twins, 36 weeks also behave as good as 37. The maturity, because of the constant pressure inside the uterus on the two babies, so they're under stress, so the maturity is achieved a little earlier compared to the singleton pregnancy. So 36 weeks pregnancy is also good enough. However, we strive to reach 37 and 38 if possible, depending on the situation. Now, sometimes it is a triplet pregnancy, or sometimes a woman is already having a child and it's a second pregnancy and the woman conceives twins and she may not want twins. So, in this scenario, there is a procedure which is available, which is known as selective reduction. Now, because of the PCPNDT laws of India, such reduction has to be taken right at 12 weeks and not beyond, because beyond that, a sex determination by ultrasound is possible. Hence, it is not allowed to terminate or to do a selective reduction at after 12 weeks. So any selective reduction, if it is reduced from triplets to twins or from twins to singleton, is done before 12 weeks. And this again, whatever it is, immunonicity, chorionicity, whether it is monochorionic or it's dichorionic, it doesn't impact the growth of the other baby. It is safely undertaken by the fetal medicine, wherein they stop one fetal heart. Before that, they do an anomaly scan to know which twin is looking healthier, and they stop the non-healthy twin, and the other one continues to grow, and then the woman can have a full-term singleton baby. When it comes to triplets, a reduction to twins is advisable. That means if there are three fetuses which are growing at the same pace and they're all looking healthy, then one has to be reduced. Otherwise, there's a possibility of losing all three fetuses at any time in mid-trimester. So it is extremely important to, to ensure that triplet pregnancies, woman has to be very strong, and if she desires only, then it is recommended to continue with triplets. Otherwise, it is suggested to reduce it to twins so that the pregnancy can reach term, because there's a very high chance of losing all three of them midway, and then it is of no avail. So triplets are now often seen in IVF pregnancies, wherein the IVF specialists tend to put sometimes, though the standard practice is to put two embryos, but sometimes one embryo can split, or sometimes when there are repeated failures, the specialist is tempted to put more number of embryos to improve the success chance of implantation, and then all embryos they get implanted, and the woman ends up having a triplet pregnancy, which is very hard to sustain, difficult to carry, and then a very tough decision of reducing a healthy baby from triplets to twins needs to be taken. So this is how multiple pregnancy behaves. Uh, it is common. It is seen very often these days, but thankfully the outcomes have also improved. So if you have any related questions or anything, we can now take your questions. I think this is a long time to explain about twin pregnancy. So I have a question here. Is there any complications in multiple pregnancy? Yes. So the complication is, once again, I'll repeat. So these women can have more chances of miscarriage, preterm labor, growth restriction, more diabetes, more hypertension. They have more complications at birth. They have greater chances of cesarean delivery, uh, and greater chances of nursery admission to the babies. So these are the main issues with twin pregnancies. But with modern practice, with modern management, with the help of ultrasound and other things, we are able to achieve twin pregnancies wherein the women are able to reach term and deliver safely. So multiple pregnancy is diagnosed by ultrasound. That's the only way to diagnose it. Obviously, there are other means like MRI or X-ray, but they are not the right thing. So it is diagnosed as early as 6 weeks, or but typically it is diagnosed at 7 to 8 weeks when the first scan is done. At 12 weeks, it is more clearly seen whether it has come from the single egg or two eggs. That means whether it is a like twin which has come from single egg, or it is unlike twin which has come from two different eggs. In assisted reproduction, so unlike twins are more common. That means dizygotic twins are more common. What are the chances of getting twins or triplets? What is the procedure? Now, if somebody wants to actually have twins, it's not a good idea. However, a lot of women use ovulation induction medicines to make more number of eggs and hope for a twin pregnancy. By doing assisted reproduction and various methods, the chances of twins can go up to 5%, but not beyond. In IVF, so the twins rates are maybe a little higher than this. So that is all. In nature, the chances of conceiving twins is only 1 to 2%. However, it is very difficult to bring up twins, especially during pregnancy. It is difficult, and it is more difficult after birth, wherein the one baby cries every 2 hours. So by the time you finish with one baby, the second one is already crying. What are the medications have to get done for multiple pregnancy? Well, it's not right. It's not allowed on this platform to talk about medicines. But yes, these are the same medicines which are given to make eggs. So these medicines can be taken, and women can have twin. It's not a good idea. It's bad to on purpose conceive twins. It's not a good idea. If somebody conceives, that's nature. We have to accept with folded hands. But on purpose to have a twin baby is extremely tough on the woman. How can I increase the chances of getting I don't know why everyone wants a twin. And this is the third time I'm getting. So the to have a multiple pregnancy, you must speak to assisted reproductive doctor who can actually guide you on taking how you can take the medicines, and what is the right thing to do. But once again, it's my request: do not look at twins. It is extremely difficult to carry twins. It is extremely difficult to deliver twins, and it is extremely difficult to bring them up at least till 1 year of age. You probably, because it's, one will cry, other will cry, one will have motion, other will have motion. So it's endless, and it's very, very hard. You will need a lot of help from the family to be able to raise. So if it happens on its own, it's fine, but nobody should take medications or try and achieve twin pregnancy artificially. Not the right thing to do. Buy one, get one free is not the right idea. What is the risk during multiple pregnancy delivery is done if normal delivery, then cesarean? In normal delivery, if the head is down, the first twin comes out very easy. There's no problem with the first twin. The complications almost always happen with the second one. Now, it's not that every second twin will have complication, but there's a possibility. The possibility is that if there's a transverse lie, that means the second twin is transverse and the cord comes out, then it's a very emergency cesarean will be conducted, and there's a possibility of baby developing fetal distress. The baby, there could be intrauterine manipulation required if the baby is not head down and the baby needs to be pulled out. The bleeding can be more. The baby can get stuck if the first baby is breech and coming out half through the half dilated cervix. So the head gets stuck and the baby is lost. So such things are not seen in current practice, where we've all seen this when ultrasounds were not there, when we were working in government setups and women used to come in labor without them knowing that they have twins. And when they fail to deliver at home, they come with babies half hanging outside. So such a scenario do not arise now because we know in advance whether it is a twin pregnancy, and if it is a twin, whether both the babies are head down, and whether they can have easy delivery or no. So such a scenario doesn't arise these days. Thank you very much for your patience listening. We'll be back. Happy Diwali. Stay safe and please avoid crackers. It will lead to pollution and breathing difficulty for those who are suffering COVID. You want to use, you can use things which make noise but not the smoke. Enjoy your Diwali, do everything, celebrate it with full zest, but please think of people who are not able to breathe. Thank you so much. Have a good day.